Hey there, this is Dr. Linda Burke. I'm a board-certified OBGYN physician, and I just want to respond to the pregnancy announcement of Gabourey Sidibe and her husband. I am extremely happy for both of them, but I'd be lying if I said that I was not concerned. So here's my playbook, being a board-certified OBGYN for over 35 years, although I don't do direct patient care anymore. But if she were my patient, here's what I would do. Number one, I would get a thorough history from her to make sure that we address anything such as high blood pressure or family history of diabetes, or if she has diabetes herself. I would also refer her to a maternal fetal medicine specialist because she's 40 years old, first pregnancy, twin gestation. Twins alone are high-risk conditions because if babies are sharing one sac, one placenta, that's called monochorionic, monoamniotic pregnancy. That means that there's an increased risk of something called twin-twin transfusion, whereas one twin gets all the nutrients from the placenta and the other twin does not. And there's a big disparity in terms of weight and other things that could happen. For that reason, I would refer her to a maternal fetal medicine specialist where they would do serial ultrasounds, making sure that the growth of the babies are growing appropriately. The other thing that I would do, of course, I would test her for sickle cell. She has Senegalese background, and so that's important. Even if her dad was not Senegalese, she's Black, she should definitely be screened for sickle cell, the sickle cell trait. If she has the trait, then hubby should also be tested. No, he may not look African-American or Black, but it's the DNA that's important. And so we don't know what his genealogy is. So if she has a trait, I would test him as well. The other thing I would do is look at her blood pressures extremely carefully. In the first trimester, I would note it. And in the second trimester, when the blood pressure should be dropping. It should be lower than the first trimester. If it is not, that is a red flag for potential preeclampsia, and you need to be very aware of what's going on because, again, second trimester blood pressure should be lower. If they're not, then heads up about potential preeclampsia. I'd also look at her platelet count in the first trimester and compare it with the 36 weeks labs in the third trimester. If the first trimester platelets are normal, but the third trimester platelets are lower, that is a potential red flag for HELLP syndrome. And I've managed a lot of preeclamptic patients and patients who've had HELLP syndrome. Gratefully, all of my patients did well. But the strength is being prepared ahead of time. So if her third trimester platelet count is lower than her first trimester, whoever's taking care of her, please don't ignore that. Please be on alert for possible preeclampsia, for possible HELLP syndrome, which is a subset of preeclampsia. During her pregnancy, I would definitely recommend a doula for support. During her pregnancy, this is why ultrasounds are important, because you want to make sure that the heads are down in terms of the twins. If one head is down and the other one is breech, that's a potential problem that you should be prepared for. After she has the baby, of course, you're going to monitor her blood pressure very carefully. Do not send her home after 24 hours of having a twin pregnancy. That is a no-no. Don't let them do that, Gabourey Sidibe. Please don't let them do that. She should also be tested for postpartum depression because it could happen. I am very happy that my sister is pregnant, but I hope that everyone who's taking care of her will give her the proper attention and care that she needs. Thank you all for watching, and I hope to see you soon. Take care.